Basically, after looking at the video, I don't know specifically what the spell was. I think that the most concerning thing that it could have been, and certainly what we talk with patients about being concerning, is with the acute onset of new neurologic symptoms, whether this could have been either a stroke or what we call a transient ischemic attack. Sometimes when patients of any age present with acute neurologic symptoms, that may be due to either a blockage of blood flow in the brain, where interrupting the blood flow to certain areas of the brain cause certain different types of neurologic symptoms. Other types of strokes sometimes are due to rupture of arteries, sometimes even including aneurysms or just small arteries due to extreme high blood pressure, what we call hemorrhagic strokes. And it was reported that she was feeling fine and basically went home. That might be more consistent with what we call a transient ischemic attack, but that's still a medical emergency. Patients that present with stroke symptoms or TIAs are recommended to go to the emergency room for evaluation acutely, because sometimes, some of the symptoms may resolve, but some other symptoms may not. What we're concerned about a lot of times when patients present with ischemic stroke, hemorrhagic stroke, or TIA is that they may have the acute onset of symptoms related to either a loss of speech or language function, difficulty understanding someone else or making themselves understood, a loss of vision in one eye or both eyes, a sudden severe headache which sometimes heralds hemorrhage, weakness or numbness on the face, arm, leg, any combination of those, especially when on one side of the body, acute difficulty in walking, loss of balance or coordination. All of these 5 things, can be what we call the stroke warning symptoms that require patients to go to the emergency room acutely for evaluation. In the emergency room, a lot of times we'll do different tests, sometimes x-rays of the brain, what's called a CT scan, to see if there is blood, hemorrhage in the brain or not. And then if the symptoms are persisting, not going away, a lot of those patients, if they come in early enough, can be considered for even acute intervention, acute therapy treatment to try to give them a return to more normal function by breaking up the blood clot, using different medications, or even sometimes devices that go in to try to restore the normal blood flow. As we see our patients in the hospital or in the clinic, a lot of the times what we'll tell them, if they have acute new neurologic symptoms, whether they wake up with and suddenly notice these symptoms new, or whether, just like the reporter the other day online with the video and on the broadcast, showed acute symptoms that occurred just while she was out and about, suddenly occurring. Either of those situations, you should go immediately to the emergency room. We recommend patients, call 911, have an ambulance come out, take them acutely to the nearest. Here in Texas, we have various stroke centers that are designated to receive these types of acute patients quickly when they've had new neurologic symptoms related to possibly a stroke. Again, the symptoms that we're concerned about are going to be, difficulties related to either loss of speech, language function in terms of being able to understand or make yourself understood, difficulties with loss of vision in one or both eyes, weakness or numbness of the face or arm or leg, sudden or severe headache, sometimes the worst headache of your life, or acute loss of balance or coordination, difficulty walking. Any of those 5 symptoms occur acutely, you should call 911 and go to the emergency room.